Hi everyone, welcome to this session on health equity through the lens of power, privilege, and population health. I'm excited to talk about this because many of you may find that these are new concepts that you might have not been familiar with. So, I think that there's going to be a lot of learning and let's dive straight into it. So why do health equities and health disparities exist? I think that's the big question that we hope to answer today. And the learning objectives for today are really to discuss the concept of health equity through the lens of power and privilege, to understand and be aware of how power dynamics shape the relations and interactions in the healthcare sector, and be able to explain the concept of privilege and its implications in the field of medicine and healthcare. Power is the ability to make others do what you would have them do. Think about that. Power is the ability to make others do what you would have them do. Think about someone who has the power to make you do something. And then think about you. Who do you have power over? So, what is power? Talking about power can be uncomfortable. It's also very situational and hard to define. So here are a few other definitions and meanings. Power dynamics. Why is that important? When it comes to population health, there are decisions that we have to make surrounding the allocation of resources and how do we address the inequities in health outcomes. So it's important to understand power dynamics. Power dynamics, whether we talk about it or not, it is there. And increasing our awareness to recognize it can make us more effective when it comes to making decisions about population health. Right, I hope I've piqued your curiosity. This is such a big field and it would be insane for me to try to cover everything about power. But here, Eric Liu does a beautiful job of explaining this in 7 minutes. So at your own time, scan the QR code and watch the video. Watch it on your commute home today. So, some of you might be wondering, what does this mean for me? Well, let's look at this slide. Some of these scenes might be familiar to you. You might be a patient, you might be a healthcare provider, you might be a caregiver. So look at these pictures and think about the types of power listed. Power over is when someone or some people are able to influence others or do something onto someone else. Power to do something, make decisions, provide options, change things. Power with is the collective power of groups, communities, or organizations. This power is built on respect, mutual support, shared power and collaborative decision making, and acting together. Power within is each individual's capacity to exercise control or act on their own will. So power, like fire and science and technology, is not inherently good or evil. It is how we use it, it is how we wield it. Alright, congratulations, we've covered power. Woo! Alright, let's take a break and get some water. If you need to stand up and stretch, please do. And we'll switch gears a little to cover privilege. So what is privilege? What are some of the examples you can think of? Privilege describes benefits that belong to people because they fit into a specific social group or have certain dimensions to their identity. We can have privilege because of our gender, sexual orientation, ability, religion, wealth, class, amongst other characteristics. And privilege exists when one group has something of value that's denied to others, simply because of their affiliation to a group, rather than anything that they have done or failed to do. For example, primary school applications. Advantage is given to children whose parents graduated from that primary school. At times, privilege is an advantage that is enjoyed by an individual who may not have acquired it through their own actions. In this case, let's talk about the Singapore passport, right? Arguably one of the most powerful passports in the world. And for those who have it, that's a privilege. And from another perspective, this is also something that is out of our control. We did not necessarily ask for it. People who hold the passport may not even notice the privilege until we educate ourselves about its existence. So other types of privilege. In the 1970s, more boys than girls went to school. In terms of application to public housing in Singapore, citizenship is important, but it's not just your citizenship, but also the typical family unit. So some call this the heterosexual privilege. And for Malaysian school-going children that are attending school in Singapore, that live across the causeway, they have to wake up at 4 a.m. to take the school bus. Children with disability often do not have the same opportunities when it comes to schools. Alright, so we covered a lot of these types of privileges and gave some examples. We're going to chill a bit. And now we're going to read through a comic strips together. So there are 4 slides. I want you to look at them and I'll read them out. Think about the opportunities and think about the privilege differences between the 2 characters. So the comic is titled On a Plate. And here you have Richard. His parents are doing okay. And you have Paula. Her parents, not so much. So Richard's house is warm and dry, his shelves are full of books, and his fridge is full of food. Paula's house, on the other hand, is full of people and not so much else. It's damp, it's noisy, and she keeps getting sick. Richard's parents will do anything for their baby, and so will Paula's. That's why they are working 2 jobs. Richard goes to a great school, well-resourced, good kids. His teachers love their jobs. At Paula's school, the class sizes are large, the school is underfunded, and it looks like the teachers are tired, stretched thin from the stress. So maybe we can see why the expectations set for Richard might be slightly different to those set for Paula. And over the years, all these little differences, they start to add up and build into something bigger. And because each little difference sneaks by unnoticed, and maybe Richard starts to believe that he deserves to be on top, that he did it all by himself. And maybe Paula starts to settle, learns to know her place. But I hope not. I really hope not. So how are you feeling? What happened in this story? Let's take a moment to reflect. What are the privileges that you see, and where do they come from? Right? Family background, right? Types of schools that attend, opportunities that they're given, and then if we look further down, how do they impact Richard and Paula's opportunities for good health and well-being? And also think about the social groups, right? How do these characters act towards people outside their social groups? And then from an intergeneral perspective, how would these differences in privilege be passed down from generation to generation for both Richard and Paula? Right, this is a nice point for us to recap on the role of power and privilege in health equity. I think the key thing that we want to ask ourselves is, who are the Paulas in our health system? Right? And for ourselves, our social identities, whether it's a patient, a caregiver, a doctor, policymaker, a researcher, how do our social identities grant or deny privilege? And then for those of us who have power and privilege, what can we do? How can we play our part to transform systems so that they help to improve the situation? So I want you to think about yourself. Everyone has multiple identities and different traits. Some of these traits may privilege us and grant us power, but in the same person, there will be certain traits that may disadvantage us. When we begin to realize that all these identities are complex and varied, our methods of investigating other perspectives and viewpoints become enhanced and developed. And coming back to this intersection of power and privilege, the goal of health equity is often to lead us to focus on those who are most in need or at risk. And if we think back to the stories of Paula and Richard, we're more likely to pay attention to Paula, right? She needs more help. But that doesn't make Richard the bad guy, right? He is probably a little bit unaware. And he's not the bad guy, he is just unaware. And sometimes those with privilege simply don't see it because it's so invisible and it is so uncomfortable to talk about it. So for us here today, let's think about what are the power and privileges that we have, and more importantly, what do we plan to do with this power and privilege? I want you to think about it based on the stories that we've heard of Richard and Paula and these scenarios that I've shared that we see in everyday life. What would you do with the power and privilege that you have? What does all this mean? We've covered a lot, and I don't think it's easy to just digest all this in the 15 minutes that we have. So it's important that we go into a self-reflection mode. Think about and seek to find out and understand more about your privilege. And I know that power dynamics is a difficult conversation, it's a bit uncomfortable, but we need to continue to educate ourselves to understand it and then know how it influences the health and health inequities and leads to different health outcomes for different groups of people. Alright, we made it to the last slide. So this is not an easy topic, but I'm glad we had some time to talk about it. Power, privilege, population health, health inequities. Let's recap some of our learning objectives. We have discussed the concept of health equity through the lens of power and privilege, and we were able to share certain examples about how power dynamics can shape the relationships between stakeholders and the different interactions in the healthcare sector. And I think after today, you'll be able to explain to your friends and family about the concept of privilege and its implications in the field of medicine and healthcare. So thank you very much. I hope you will spend time to reflect on this, digest it, and let your power and privilege be something that you use for the good of the patients. Thank you.